Hi everyone, welcome to this week's episode of Simplicity TV. This is your Cut the BS series that we run for you each and every week. I'm Jen Pike, your host, and today I am joined by a good friend and colleague of mine, Kim Peace. Hey Kim, how are you?
Good morning, how are you?
I'm
Thank
good.
you for having me.
Yeah, you're welcome. Thanks for coming. So you have what I think of as being a really cool job, and you are very passionate about it. And it is something that is typically, I would say, a taboo topic for a lot of people because you run a business that focuses on colon hydrotherapy.
That's right, I do. And I'm in love with my job. I've got a really awesome job, and flushing people's bowels is what I do. And yeah, it's got to be done. So
and you know, it's interesting because, I mean, for me, I always say this to people, like, I pretty much talk about poop for a living because it's a huge gateway and messenger to the full story and spectrum of what is going on in your whole health and in your whole body.
Absolutely.
And I always say to people, you know, specifically women as well, is that if you think about it when you have your babies, they can't talk to you yet, they can't communicate and tell you how their body is feeling verbally, so we look for signs like what's in their diaper.
Absolutely.
Right? When you have a baby, you don't just, you know, quickly wipe, throw it, get rid of it. You're looking at it. What's coming out, what's not coming out, how are things going? And then we get to a certain age where we're independently doing that for ourselves. We stop looking and we actually lose part of the messengers from our body.
Flush right away. It's the courtesy flush. How many times have you heard that? Oh, just flush, don't even look, just go.
So I deal with a lot of clients who have quite debilitating digestive issues going on. And I think that that's something we've also become a bit too comfortable with, the discomfort of digestive issues. So constipation, diarrhea, hemorrhoids, polyps, a lot of gas and bloating, having to take a lot of over-the-counter different types of remedies and medications that are really just suppressing our body's ability. So what is it that you provide for clients who come in to see you?
I provide a safe and open environment for people to openly discuss their bowel health. Most people, like you said, they've never spoken to anybody, not even their spouse. They won't even go to the bathroom in front of their spouse. It's never been talked about in front of their families, certainly. And now all of a sudden they're coming in with extreme discomfort of the usual culprit, bloating and gas and so on. And it's either going up this way or it's going out that way with the gas. And they can't identify whether it's a food situation or if it's a sensitivity or if it's a lifelong constipation, if their bowels have been off from the get-go as infants, or if it's a disability or a chronic disease, cancer, MS, and so on. So I'm there to just give them relief in the bowels. I'm not a doctor, they already know that. So I'm not there to provide medical advice. I remind them that my role is to simply provide bowel relief in the ways of soaking down the bowel by gentle by irrigation, an open system via gravity, filtered warm water up the bowel to help relieve the bulk and the congestion in the bowel.
And what's happening actually is that you're inserting a speculum into the bum, and you are using that water that's going in, and it is starting to fill the space and build up a bit of pressure. And what it does is it's helping to gently encourage whatever fecal matter is inside the bowels to loosen up. So the water gets around it and helps to get it off the walls of the colon and the intestinal tract. And then once you feel that pressure, then naturally it's going to contract to try and push and get it out.
We are encouraging the bowel to purge. We want the bowel to be stimulated, almost as if you're encouraging flu-like symptoms. And I know it doesn't sound really fun. Colon hydrotherapy is not fun. It's necessary.
Yeah, it doesn't tickle.
No, not by any stretch of the mind. But when you introduce water up the rectum, We want to, we want to stimulate the bowel to squeeze, because most of us have a really sluggish colon, very stretched out, non-responsive colon. And so by inserting, not only are we flushing out the impaction of the bowel, but we are also stimulating the bowel to squeeze, which is kind of like boot camp for the colon.
Which is so important, because we forget the muscles that are on the inside that we're not actually seeing when we look in the mirror. They need to be worked out just as much as the back muscles, the biceps, the glutes, all of that. And obviously for myself, teaching so much about exercise is that these muscles, they become laxed over time, and that can be from poor diet. It can be from not having a regular bowel schedule and routine, so holding it in too long, not making the time for it. It is huge, because you know what? People get up and they're rushed in the morning, then they go to work and they don't want to go in a public bathroom.
Right.
Then they get home and they're rushed. And a lot of people, I have clients, I kid you not, some people who are going once every 4 days, once every 8, 9, 10 days, and then are having to use something like Restore-Lax or even Senna-Leaf to try and get things moving.
Suppositories, herbal teas, medication through their physicians. It's a very sad situation.
And the problem with those types of what we perceive to be as, solutions, what's actually happening on the inside of the body when we bypass the body's natural mechanisms?
Well, it's almost like the bowel just kind of sits there and goes, well, I don't really have anything, I have no purpose, I'm just going to sit here. And the muscles, it's almost like how you would say, you don't use it, you lose it, right? So you don't work out those arms, they're going to start flapping in the wind. It's the same thing,
right?
But it's on the inside, and we're not noticing it until we wake up one day and we got that pooch that you're just kind of like, where did that happen? Where did that come from?
Or you can feel it or see it on one side more than the other.
Yeah, or also in the lower back.
In the lower,
as well.
Yeah, it refers back there. It's interesting to me, because we talk about certain steps like making sure that you're getting enough hydration so that you are flushing orally, like you're drinking enough water, decaffeinated organic herbal teas, you're getting enough fiber in so that it's adding bulk to the stool. That you're eating clean and healthy foods that aren't mucousy and mucky and creating that dampness. And then you're also taking the hydration at the other end as well. So we're meeting it on both ends. Things like enemas and colonics, they have been around forever.
This is not a new concept. This is not a tree huggers thing. It's not. I've heard people say, well, it's in fashion.
Like it's a
because
fad.
Celebrities are doing it. Well, that's nice, because they're the smart ones, and they've got they're paying people to look after their well-being.
And here's the thing on that. I'm glad you actually brought that up, is that they have the financial resources to pay the best of the best. And the reality is the best of the best at what they do know that the biggest secrets are the old school traditional ways of what and how we treated our bodies before we got in the way.
That's right.
Before we started to bring in these over-the-counter medications, suppressants, before we were sitting for so long in our days and not stimulating our bowels.
That's all we do all day long, is we sit 90 degrees in our chair all day long, and then we sit on a toilet. Let's go back to the sit situation. So we're sitting on a traditional toilet with our legs at a 90 degree. Well, there's that muscle band, right?
Yeah.
That's from hip to hip. That is actually strangling the sigmoid, just giving it a pinching that sigmoid off. So that's why people are straining on the toilet, right? So when you go back to back in the day where people had to squat, that's the way humans were designed.
It's the most primal movement, squatting, and we need to get back to doing it.
We absolutely do.
So that's where
a little footstool like this, or a squatty potty, you see them online, and they have the funniest YouTube video out there. I encourage you to go and have a visit, because you'll laugh your head off.
We'll make sure to include that in the links for you so that you can see that.
Anyway, get those knees up. You want to get those knees up and lean over and be comfortable. We don't want you sitting there for a really long time, because the rectal area does not dig that position.
No.
Right?
And especially too for children. So we use, this is actually one of our, and this is from the dollar store. I mean, you can get the squatty potty stools. There's a couple of companies that have them. But for children as well, I mean, their feet, they're dangling. So they don't have
And elderly
anything.
as well, same.
And we've done this really ridiculous thing where we've made higher toilet
Yes.
seats that we've marketed towards
right.
the elderly, so they don't have to bend as much to
Right,
sit down.
right.
You're actually creating a deeper issue.
Huge problem.
And we talked about these traditions. I mean, you look in other cultures. I've lived in areas of the world where I remember when I first moved to Japan, I was 17, and the first public washroom I went into, I opened up the first door and there was a hole in the ground with railings, and I was like, oh, what's this? This washroom must be broken.
Right, right.
And I went to and they were all the same.
Yeah.
And even in the apartments that I lived in, the toilets were like the one you have in your office,
Yes.
very low to the ground.
Yes, very low.
So it puts your body ergonomically and physiologically in a better position to help make it happen.
That's right, because then that muscle band, when your knees are up in a squat position, if your knees are raised 7 inches, a 7-inch rise is perfect for most people. It actually loosens that band from the pelvis, and so therefore the sigmoid is not being strangled.
Right.
It also changes the shape of your bowel. So we've got this big curve going on here with your bowel, and now when you're in a squat, it actually shifts it to a straight tube. So
Like
yay!
Yes, yeah, it's amazing. In yoga, there is a posture called malasana, which is a deep yogi squat. It's so excellent. It's actually, a birthing position as well. So anytime, and that's what we're doing when we're having a bowel movement, is we are birthing out
right.
what is no longer serving us.
That's right.
The body wants to get rid of that waste.
It does.
So how often would somebody come to see you for sessions?
Everybody's bodies are unique.
Yeah.
So everybody's needs are different, and how many sessions is completely dependent on them as
What's going on
individually.
Yeah.
Exactly. But generally, we start off with 3 sessions, nice and close together, meaning within 2 weeks.
Okay.
To make sure that bowel is getting a good soaking. And then we judge treatment by treatment on how they're feeling and how they're doing with their homework.
Right.
So when they're working with you or their naturopath,
Yeah. Using the
with their
stool,
plan, using
those
the
different
stool,
types of things.
and so on. Yeah, it doesn't just stop in the clinic when they leave. It also has to carry through in lifestyle. So this is some lifestyle changes that people are making.
Right.
And
And it's not just dietary.
It's
not
not.
just drinking more water. Those are essentials. Those are really
Yes.
the fundamentals.
Yes.
But what are some of the other situations or things that you see?
I am seeing emotional. When someone's emotional house is broken, and they will share with me their pretty heavy stuff, and it's all confidential, of course. But that being said, when somebody's spirit is broken, when they've got big stuff and they're carrying big stresses, big stuff in their souls, they have to start working on stress management and emotional health.
An emotional release, because we say it sometimes as it's like funny or sometimes cliche, but sometimes you're literally full of the crap that
Yes.
you are not letting go of.
Right.
And that matter is made up of more than just, soluble and insoluble fiber and
Absolutely.
proteins and fat and all of
Absolutely.
that. So
it's all bubbling in there.
It is.
It's all bubbling in there
Yeah.
like a volcano. We have to work on your emotional wellness as well. It's all going to come together. Mind, body, spirit
Yeah.
is going to help. They all work together. When everybody's all in good health and in good working order, it's only going to make your colonic experience that much more effective.
Yeah.
So
And you create I've come to you a couple of times, and what I really love is you make what could be the most uncomfortable experience be so genuinely comfortable.
Yeah.
The room that you have it in, you use hot stone. It's your very,
Yes.
you're not trepidatious about
No.
it and don't act awkward about it at
No.
all. And so it immediately, as the person that is having the treatment done, feels, like it's like, okay, this is, you start to understand the greater good of why you're there and what you're doing for your body.
For sure. And it's really important to have that professional, of course. But you know what? This is a pretty intimate situation here, and my goal is to try to make you as comfortable in an uncomfortable
Yes.
situation
As
as
possible,
possible.
yeah. And you do that. You do that
try
really
to
well.
make it fun.
Oh yeah,
and
and
a
it,
little bit of humor to it where appropriate.
well, really,
of
if you
course.
can't laugh in that
Well,
situation,
no kidding. Well, there you go.
yeah, that could be possibly why there's some issues going on down there.
People need to laugh more.
And you work
right?
with, I love the testimonials, and I've been talking to so many people over the last couple of years, and a lot in the last couple of months about this, is that you're working with people who just want generally better health, people who are dealing with autoimmune disorder, parasites, a lot of inflammation, pain. So it really, there's no one-size-fits-all
Not at all.
approach, but it is for everyone.
It is, and and then there's the basics, of course, of keeping your colon smiley and happy,
Yeah.
keeping it hydrated, and keeping it relaxed with
Yeah.
the belly breath. People are not breathing.
Yes.
I know that you find that in your
Yeah.
business. You have to teach people
How to breathe, which is crazy but
Yeah.
understandable at the
Yeah.
same time.
So it sounds kind of funny, but
So how can people get in touch with you and book an appointment?
I can be reached at my telephone number is 289-231-2705.
Okay, so we'll have that across the bottom for everyone.
And, at Nature's Emporium in Daylin
Yeah.
Wellness at daylin.com, daylyn.com,
Okay.
or in King City at itsallaboutyou.com.
Okay, so a couple of different ways to get in touch with
Yes,
you.
mine
And I know
can be
you're
found.
being very gracious and offering a discount
Yes.
to anybody who's viewing this. So you're offering $10 off
$10
their
off.
first
Yeah.
treatment,
Yeah.
their first session with
Yeah.
you,
Yes.
which is fantastic.
Yes.
Well, thank you so much for coming
Thank
on
you for
today.
having me.
Yeah, I think this is, again, such a great topic to have
Yes,
for
it
Cut
is.
the
It's
BS
very
because it is exciting. And it is the beginning to a very healthy journey for a lot of people from the
Absolutely.
inside out.
It's got to start at the bowels.
Absolutely. Thank you so
Thank
much for
you.
coming on today. You're welcome.
Thank you.
Thank you guys for listening to this week's episode. I hope you took away some new information or maybe some information you'd heard before that you just needed to be reminded of, and that you take your next first step along your health journey and path. Have a fantastic day, and we'll see you next week right here on Simplicity TV.